Good morning. Come on in. Come on in. Yeah, it's getting really nice outside. So, you're here for your cranial nerve exam? It's about time. We're about due. Well, sit down. My name is Dr. Angie Michaels, fist pump, and I am here to help you. So, what can we do to expedite your exam and get you back out in that nice weather? It's beautiful out, isn't it? Is there any other medical issues you want to talk about before we do the exam? Something you want me to look at, check out for you? Okay. Definitely take a look at that. From your records, right here. So your name is... Good. Okay. And your date of birth? And when did this problem start? What's wrong with this pen? Pen is making a lot of noise. Okay, I think everything's pretty straightforward except for that one issue that you brought up, so we'll take a look at that as we progress. Real quick, I want you to look at my nose. I want you to look, focus right here. Tell me when you can't see this. Good. Good. Okay, same thing with the over here. Keep looking straight ahead. And once more over here. Good. And once more on this side. Excellent. Now, looking straight ahead, I need you to take, looking straight ahead, these little pens. Okay. I need you to tell me which one is closer, further, closer, further. So right, left. Which one is closer? Which one is closer? Good. Now tell me when they go away. Okay? Tell me when they go away. Tell me when they go away. Good. Which one is closer? Point to it. Closer. 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 The idea too is not just which one is closer, but seeing you point to it. This time, touch the tip of it. Reach up, touch the tip, okay? Touch the tip. Touch the tip. Very good. Okay. I want you to look straight ahead. Same thing. Hear that? Okay, you can hear it fine. Please close your eyes. And when I do it, I want you to point to which ear. Ready? Which ear? Good. 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 Keep going. Good. Good. Which ear? Good. Good. Now, feel the vibration. I put it on your head. You like that? Good. Same thing. Tell me which ear. Good. 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 You're doing great. Good. 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 Okay. Now, really quickly, I need you to do something for me. You should look straight ahead. And good. 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 Thank you very much. Same thing with the other side. Look straight ahead. Good. 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 Excellent. Thank you very much. Now, this time, I want you to tell me when the light disappears. Now, this time, cover up this eye. Same thing. Tell me when the light disappears. Good. 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 Cover up this eye now. All right. Tell me when the light disappears. Good. 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 Excellent. Now, I want to take my magnifying glass and I want to get in closely and I want to look at your, I don't want to use an otoscope for this. Good. And the other eye. Good. Excellent. I feel comfortable with that. Your eyes are in great shape. All right. Really quickly. Please open your mouth. Say ah, ah, ah. Good. We are going to take a bacterial swab at your mouth, just in case. We'll see how that goes. Okay, and I'll put that in. We'll send that to the lab. Okay. Let me, since we got that swab, let me call my receptionist real quick and we'll get an outside line here. Yeah. Yeah, I have a sample. Yeah, I have a throat culture. I want you to rush down and get me to the lab and get me a quick result. Okay, come on in. All right, she's going to come in. All right, and here's the swab right here. Okay, let's get a result of that right away. Thank you very much. Okay, yeah, go ahead and shut the door on the way out. Yeah. All right. Yeah, you can just call me when you get the result. Excuse me, I gotta get a quick drink. Okay. Next thing I want to do is I want to just put a little bit of this dilation in your eyes, if I might. Can I do that real quick? Do you mind? Just put a little dilation in your eye. Just lean back, you're doing great. And over here. And let me see where the tissue's at that I had. Tissue to wipe your eye off. Good. Now, I need you to... Oh, those tissues just fall apart these days. Now, real quick, I need you to look right at me. Focus. I'm going to do fingers. Tell me how many I'm holding up. Okay? Good. 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 Check your face. Puff your cheeks out. Like that. Good. You're doing great. Good. You're just doing absolutely wonderful. Now push up on your eyebrows, then pull down on your eyebrows. Push up. Resist. Push down. Resist. Good. You're doing great. Rub you right here in the glands. Okay. So right here. On the side. And your neck down here. Doing great. Okay, let me stick your tongue out. Up. Okay. Side like that. Good. Alright. Now, this next part, I'll check your heart rate real quick. Okay. Just breathe deeply, but normal. Okay. Yeah. Sound great. You have any problems with phlegm in the morning? Okay. Yeah. That's pretty normal, actually. Okay. I would like to take a swab of your skin. I want to use a little bit of this alcohol on it. I should have done it earlier. Sorry I forgot. Just dip this in. And I just want to wipe right there in your face a little bit. Okay. And then we're going to get a clean swab. Clean swab. I'm just going to rub that area really hard. Okay. Let me get that skin sample. I feel terrible to make her run back in here. So, yeah. That's me again. I'm so sorry. Could you come in? I know you. I have a skin culture I want you to do too. I'm really sorry about that. Okay, thanks. Really sorry. I feel terrible. I don't like running her around. Come on in. Here it is. Right, you run that down too. Yeah. Do you know what I'm checking for? Okay. Here you go. I'm really sorry I ran you around today. I'll make it up to you. We'll get you out early today, alright? Okay, thanks. You can give me a call when you get the results. Alright. Thanks. Okay, now if you want to sit up and closer to me, we're going to do some reflex checks. Okay? All right. Sit a little closer. I'll check your... Okay. Good. Your wrist. Let me take the weight of your arm. Good. 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 All right, let's get the other arm. So let me take the weight. You're doing great. Just let me take the weight. Wrists are doing good. Okay, really quick. I want to have this sharp end. Look, it's not sharp. Like, just tell me when you can feel it, okay? You feel that? Okay. Every time I do it, just tell me when you say okay if you feel it. So say yes. Ready? Okay. Good. 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 Yep. On your face. Good. 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 Excellent. Feel that? Okay. How about right there? Good. That's very good. Right on your chin. Good. And then down the other arm. Good. Feel it? Good. Excellent. Now we're going to do your knees and your ankles, okay? So, just let me take your knee. Let me take the weight. Check the reflexes. Good. Good. And your ankle. Good. Now we're going to do the other knee. You're doing great. So let me take the weight. Okay. All right. And then your ankle. You're doing wonderful. And then I'm going to just poke. I want you to close your eyes. Tell me if you feel this poking down there. Feel it? Feel it? Feel that? Okay, that's good. I think we're good. All right, so the next thing I want to do is I want to see if you can smell these odors. Okay, I have the very noxious gas here. Close your eyes and tell me if you smell this. I think that's pretty good. I think your sense of smell is just fine without going too much further. Okay, I'm going to ask you a silly question. How do you... It's not silly. I want you to think about it. How do you feel right now? How do you feel? Okay. Tired? Feel good? Okay. All right. All right. Just asking. There's no right or wrong answer. Okay, I just want to write something down real quick here. When do you feel like that the most? In the morning or the evening? All right. Okay. Excellent. Okay, I wouldn't worry about it too much. Okay, oh, here she is. Okay, my phone's lighting up. Let me see if I can get this number real quick here. Let me see here. Oh, I missed it. Oh, I need to call her up here. The lab. Yes. It's Dr. Andrew Michaels calling in for the lab. Okay, yeah. Oh no, I don't mind. I know I'm running her around way too much today, so I appreciate you calling me directly. Where are we at on the swab? Mm-hmm. Okay, that's the mouth swab. Okay. Alright. Where are we at on the, you have that too? The skin swab? Okay. Let me write that down. Hang on just a second. I just want to write that down. Yeah, I'm with the patient right now. Mm-hmm. Yeah, I just want to write that down before I forget. Hold on just a second. Don't worry, everything's fine. Yeah. Okay. Yeah. Okay, I'll call you back in a little bit. We'll work that out. Alright, thank you. Alright, you've been great. Alright, take care. You too. Okay, the good news is you don't have strep throat, but you do have a little minor bacterial infection in your throat, and it's really easy to treat. We're going to give you some mouthwash. You just gargle it, and you don't even need antibiotics for it. We can get rid of it pretty quick. It's just a topical bacteria thing. I'll suggest what you do is we can go over it now if you want, or we can do it in a little bit. Okay, it's real simple. Basically, we'll want you to throw away your toothbrush. Well, first of all, go home, do your normal routine, brush your teeth, floss, everything. Then throw that toothbrush away. Use the mouthwash, rinse, clean your mouth out and everything. And then we want to get you a new toothbrush at that point. And see, if that helps a little bit. Cut down on the bacteria. You won't want to cross-contaminate from the old toothbrush. And then after you're done brushing your teeth with the new toothbrush, it's brand new, so you don't have to do it the first time. This time we want you to really wash it off in hot water. Then take and boil some water and just let it set in that boiled water for a little bit. Not boiling, but near boiling. Let it sit in that water for a little bit with a little bit of salt, and that'll help kill anything that's residual. And just repeat that process twice a day to brush the teeth. Clean it every time with the salt water and you just put just a little, not a spoonful, but like just a dab of salt. Boiling water, pour the boiling water over the toothbrush a little bit, and it doesn't have to be boiling hot, just hot like tea water basically. And yeah, and then you just dump it over into the glass with the salt. Stir it up with the toothbrush, stir the salt up a little bit, let it sit there, and then rinse it before you use it every time. You don't want to have any bad bacteria. You don't want to collect. And just do that for about 3 days with the mouthwash, and we should be able to get rid of that bacterial infection in your mouth pretty quickly. Yeah. Okay, how do you feel otherwise? Okay, now the skin swab come back completely negative, so that's not a big deal. It's springtime, you've been out in the sun. I actually think what we're talking about here is a little bit too much sun, and you might have got like a little bit of a sunburn there. Okay, I don't think that's anything to worry about. All right. Okay, good. Yeah. Do you have a minute? I've got to make a real quick phone call. I just got to call my receptionist and let her know. Let's see. Yeah. Hi. Yeah, I got the lab results. Mm-hmm. Yeah. Everything's pretty good. Do you go back in the storeroom? I know I'm asking you to do something else for me. Okay, do you know that mouthwash I use sometimes for those bacterial infections that have been popping up? Yeah, yeah. Could you go back in there and get me a bottle of that? I think I have some samples back there. You think? Okay. Yeah, I'm almost done here, but okay. All right, well, check real quick and let me know. Well, just bring it in. Okay, you can just call me. All right. Okay. All right. Okay. Okay. Okay, bye. Okay, bye. I think I'm running my receptionist around a little too much today, and that's a no-no. I think I might have to be buying her some flowers for Secretary's Day or whatever they call it now. I don't even know if they call it Secretary's Day, but I think I'm being a little bit of running around a little too much. too much. Yeah. So that was quick. Let me take this real quick here. Okay. Yeah. Okay. Well, yeah, just keep it on your desk and they can pick it up on the way out. Sounds good. Okay. I know. Okay. All right, we'll get you out of here early today. All right. Okay. Sorry I'm running you around so much. Okay, you've been great today. Okay. All right. Okay, bye-bye. Okay. Well, looks like I'm buying lunch today. Oh, so that's okay because I'll have her get me something too. What a great guy. All right, so where we're at right now is the skin is fine. Your complexion is fine. I think you got a little too much sun on one side of your face. Maybe were you driving with the window down, arm out the window? You had a long sleeve shirt on. So your arm was pretty much protected, but your face is what took most of the brunt of that sun on one side. That's what's going on here. And we can get some topical cream for that. And I think I have some right here that we can apply to that. Just hold on a second. I just have this little first aid cream right here that will work wonders for that. And we'll just put a little bit of, I'll just put my finger. Just hold on a second. I can't get the cap back on. Alright, it's a brand new tube here. A little sample tube, and we're just gonna put that on there. Now, how's that feel? Okay, great. So what we're gonna do is I'm gonna give you this tube. It's a free sample. We're gonna give that to you, and that will help you alleviate some of that sunburn and that raw skin. You can put it on your whole face if you want. And it dries clear. And it's a SPF sunscreen. So I was going to tell you too, it's summertime. Start wearing your sunscreen. It's never too early, even in the northern hemisphere. A little sunscreen. You're not only preventing sun damage, you're also preventing it. It's also anti-aging. And I think that's important in our society because people are living a lot longer. So, every little bit helps, okay? So go ahead and use that sparingly. Just a little bit goes a long way. Yeah, you can, if you rub it in, it'll, yeah. And it dries clear, so it's going to do great for you. And on your way out, you can pick up your, it's a prescription mouthwash, but I happen to have a sample of it. So what I'm going to do is I'm going to write you another prescription for more if you need it, but I don't think you will. I think this one will do it. But I'm going to write you a prescription. Tear that off the pad here. And here's your prescription for that. And I'll write that down. And that'll take care of that. Okay? And you can just pick that up on the way out. And if you do feel like you need more, that should last about a week. You only take like a mouthful every time. Swish it around your mouth, gargle it. It lasts pretty long. It's a pretty big bottle. But if you feel you need more, you can use that prescription I gave you, okay? I wouldn't use it all the time, but if you get a little sore throat or this comes back, it's no big deal. You can do that, okay? Sound great, okay. All right, well, it was really nice meeting you today. All right, and yeah, we'll see you soon. I'll tell you what, I'll schedule you, when you're out there, schedule a 2-week checkup, and we'll see where we're at with everything. Okay? All right. All right. Good. All right. Well, bye-bye. Yeah. Yeah, just close the door on the way out because I've got to make a quick phone call. All right, thanks. I call the lab. Yeah, it's Dr. Andrew Michaels. Oh, I know. Well, that's what you get. No, I didn't say anything. Are we still on for that? For dinner? Okay. Yeah, well, I could use some fun times after the weekend I had. I don't know if I told you. Yeah. We definitely could go to dinner. I don't know if I'm up for. I'm definitely not up for that, but maybe a movie. If you and your wife want to go, I don't know. Well, what happened to us? Oh my goodness, I don't even know if I can talk about it. Yeah, we had a death in the family. I think it was the easiest way to say it. My daughter's cat. I know it's silly, but when you have something like that in your house for 14, 15 years, it's heartbreaking. And he was still healthy. It was really ugly how it went down. He got killed. Yeah. Yeah, it was really, really bad. I know it's a little bit of a downer, but I thought I should tell you because right now it's just hard for me to be fun. And I don't want you to think anything bad. Yeah. Well, I'm sure the ladies will have a good time this weekend. There's a lot of new movies out, so. Well, there's that. I don't know. There's this new superhero movie about villains, where the villains try and take over the world. I don't know. It looks funny. Colin Mockery's in it. It looks like a fun movie. Probably not that good, but it's a limited release. It's playing in the area though. Yeah, we saw Godzilla and Kong. Yeah, yeah. We haven't seen Ghostbusters yet, so we could do Ghostbusters. Does that sound good? All right. Well, maybe we'll do that Saturday. Okay, sounds great. Yeah, let her and the kids know I said hi. Okay. I really appreciate you saying that. Yeah, it was Jack the cat. McKenna's little baby boy. I can't win. I know. I know. Yeah, well, it takes time. Yeah. All right. Well, I really appreciate you saying that. All right. We'll talk to you. Let you talk to her. I'll talk to mine. We'll convene. We'll compare notes. Whatever. We'll work it out. Sound good? All right. Take care. All right. Have a good day then. All right. Bye. Well, yeah, I sure am going to miss that silly cat. He was a good boy. But that's the way it goes. We'll see you at the Rainbow Bridge, Jack.